Review webinar. I am Lauren Hussein from OACHC and will be managing today's webinar. Before we get started today, I would like to cover the basics of GoToWebinar. Just an FYI, this webinar is being recorded and I will email out a link to the webinar by tomorrow. On the left side of your screen is the presentation screen. You can resize by clicking and dragging the lower right corner. On the right side, you will see the control panel where you can interact with us, type in your questions, and access handouts. You can also hide the control panel by clicking the orange arrow at the top. The next item is the hand icon. You can use this if you need help during the webinar, and we will send you a chat message to see how we can assist you. Lastly, on the control panel is the question box. Please type your questions in the box as you think of them, and we will answer them at the end of the webinar. I would now like to introduce Marie Grady, OACHC's OPCWI Program Coordinator.
Good evening, everyone, and thank you for attending our fourth OPCWI webinar for year 4. And we are very excited to have Marie Meckel here present this evening. She is Assistant Professor at Bay Path University in Longmeadow, Massachusetts. Currently, Marie also practices at Mason Square Community Health Center in Springfield, Massachusetts, where she has been there for 16 years. Her clinical interests include management of chronic disease and its impact on underserved communities and social determinants of health and how it impacts healthcare in the United States. Marie has a strong interest in promoting the PA and their equivalent as a global solution to the primary healthcare provider shortage, especially in resource-poor countries. She has been engaged in work internationally that gathers data on the international PA and has interviewed and written articles on PAs around the world, especially in Africa. This work can be found in Global Health Rounds and Clinical Advisor, which was created and maintained by Marie since 2013. Under CDC-funded grant at Walter Sisulu University in South Africa, she helped introduce the clinical associate, the South African equivalent to the PA, into the healthcare system to address the healthcare provider shortage. She also received a Fulbright to work on clinical education in South Africa. Here, I introduce to you Marie Meckel on how to implement SNAPPS into a clinical education.
Hello, everybody. Thanks for taking the time to learn about SNAPPS. I truly appreciate it. I know that it's 6 o'clock and you probably have other things to do. So I'm a PA educator, and I've also, in clinic, I train PAs. And for my master's in medical education, I wanted to find a better way to train PA students and then nurse practitioner students. So this work is about what I did with SNAPPS in the clinic. And I'm hoping that I inspire you guys to try using it in your clinic. And so the goal, which we'll get to shortly, is what SNAPPS is, why use it, and how to use it. So that's my goal, but it's a pretty straightforward tool to use in the outpatient setting. And the goal of the tool, or why use it, is to make it a more student-centered environment. And I'll explain what that is shortly. I guess at the end we'll have questions. I guess the reason we're going to do this versus asking questions as we go along is that some of the questions I will have maybe addressed by the end of it. Okay, so let's begin. So how to implement SNAPPS into clinical education. So the objectives of this webinar is to understand the SNAPPS as an educational tool, appreciate SNAPPS and how it can transform the learning experience into a student-centered learning environment, understand how to use SNAPPS in clinical education in the outpatient setting versus the inpatient setting, discuss its potential use in NP and PA education, which I'm more familiar with because I work with PAs and NPs, discuss its potential use in dentistry and oral health, which I obviously have less expertise in, but I do have a study we'll talk about, and discuss its potential in mental health. I tried to find, and when we get down further in the presentation, I tried to find examples of how SNAPPS was used in mental health, and I couldn't find any in the literature search. So that's to be determined how SNAPPS is used in mental health. Okay, so let's see. So what is SNAPPS? SNAPPS isn't, literally it's a lamination that you see in front of you. It's an acronym, and it helps in patient presentation. In the outpatient clinic, patient presentation is obviously very important when the student goes in to see his patient and comes back in to report on them. So the SNAPPS stands for summarize the case. A 55-year-old female with a past medical history of diabetes comes in today with chest pain. That's summarized. Narrow. I think this patient might have, my differential is reflux, MI, PE, the different differentials. Analyze. Based on the symptoms the patient presents with, I'm concerned about an MI. Okay, so that's the part that most of us as preceptors are familiar with. We know that we know that students need to learn how to present a patient. The P for plan that you see after the probe is also part of something we expect from our students. They make a plan based on the history. I think this person might have an MI. I'm going to do an EKG. I'm going to call the ambulance. I'm going to give them an aspirin. That's a plan. The probe and the select make this tool unique. The probe is the part of the SNAPPS tool where the student asks you, the preceptor, a question. The select and issue for self-directed learning is the student's takeaway from the case, or based on their probe, their self-directed question. So I'll get further into but I want to talk a little bit about this now. So every student who comes in to see us that we educate has their own context. They could be a nutritionist. They could have spent the last month in cardiology. They could have been a respiratory therapist. We don't know what their context is. I mean, this is generally speaking. When I had students, I didn't really have time to go through their resume and learn about, what their background was. It's in our health center, it's pretty fast moving. The students come in, they rotate through 10 different preceptors, so you don't know much about them. You ask them questions, but the point of the probe is that the student might have their question that is not based on the chest pain. So the case I just demonstrated, the 55-year-old with a past medical history of diabetes and hypertension, they might have just come off a cardiac rotation. So they don't have questions about this case, but they might have questions about why this patient is on Zocor versus Crestor. So I can't, as a preceptor, I can't anticipate what they're going to ask because I don't know their context. So the probe makes it student-centered in the sense that they get to ask me a question about the case that I couldn't have anticipated. The select an issue for self-directed learning, I help them, or they tell me, I'm really curious as to why I see in the medication list that they have a steroid ointment versus a cream. I've heard that ointments are stronger than creams, but I'm not entirely sure. That is going to be my takeaway learning need. Again, not related to the case at hand, but related to the student's learning. So SNAPPS is a tool. You print it on a lamination sheet. I'll show you. The student carries it around with them, but this is in essence what the SNAPPS tool is. I've kind of told you a lot, but I want to give you some context as we go along. So this is what the SNAPPS is. It's an acronym. It stands for summarize, narrow, analyze, probe, plan, and select. It's designed to help make it a more student-centered learning environment. It's designed for the student to get the most out of the learning experience. And most importantly, it does not put the pressure on the preceptor to necessarily do anything different, because as we all know, working in health centers, it's a fast-moving learning environment, and we can do what we can do, but we can't implement too many kind of time changes into our day because it's hard to do those things. So that's in essence what SNAPPS is. And now we'll go a little bit through things in more detail. All right. So this is the lamination. I'm sorry, it's such a small picture, but I wanted you to literally see. You make a lamination, you give it to the student so it's pocket-sized. We'll talk about the training and how you train the students and the preceptors to use it, but this is literally what the tool is. It's a laminated sheet. And you can see summarize the case, narrow the differential, analyze, probe, plan, and select. Okay, let's see. All right, I can't see my slides. So, oh, sorry about that. Let's see. So we talked about it's a guide to help in patient presentations, and the first part of SNAPPS talks about is the patient presentation. The last two elements makes it a more student-centered learning environment. Again, we don't know the student's context, so knowing by creating a student-centered learning environment, the student comes away with more of a rich experience, and they get more of their learning needs addressed without kind of stressing out the preceptor. Okay, so we talked about that. And I guess if you could type in if I'm going too quickly. So if you can email or text in to Lori or Marie and tell them if I'm going too quickly. Yeah, and okay, that's good. All right, so that's what SNAPPS is. All right. So what I did in this slide is I wanted to take the different elements of SNAPPS and show, so I told you that the first part of SNAPPS, SNAP, is the summarize, narrow, analyze, and plan, and then the last two elements, the probe and the select, are the parts of the tool that make it a more student-centered learning environment, where the student kind of gets to, ask their questions about the case. And again, it doesn't have to be about what's related to the case. Okay. All right, so why use it? Why use this tool? So, and this is based on, I did a study at my health center for a year, and I had students use the SNAPPS model, and I interviewed them afterwards. I wrote up the interviews, and I created a code book, which is a way to do qualitative research, and I looked for themes. And I did a lot of, I did a literature search to figure out who uses SNAPPS and why SNAPPS is used. But in essence, the teaching and learning that occurs in the outpatient center is 3 to 5 minutes between patients. So when the student goes in to see a patient and they come out and report to us, really the learning takes place in that 3 to 5 minute period in the outpatient setting. We have a very short period of time in which we can do our best teaching. Asking the student questions that we think are relevant to the case aren't necessarily the best methods of doing this. So what do we do instead? Using this SNAPPS model puts the power in the student's hand, and they get to ask us questions. But by using the guide, it kind of serves as a standardized mechanism in which they can ask us questions. So if we just say nothing for 3 to 5 minutes and wait for them to ask questions, that's probably not going to happen. They need some kind of guide or some system for themselves to ask us questions. I want to say one more thing. So I told you that I did research for a year, and I asked questions to students, and I interviewed them. And the reason why I became excited about this tool is that many of the students said that by using this tool, it forced them to ask questions, it forced them to dig deeper, it forced them to start thinking about things they didn't know about. It became, some students said that it made them more brave in their question asking. It said that in previous rotations, they went home and they just read things up, but by having this 3 to 5 minutes being as efficient as possible, they were forced to ask me questions, and that made them, that gave them skills. And what do we want in any kind of clinician? We want them to be self-directed learners. We want them to ask questions of their colleagues. Like that's the best kind of health center environment we want, is when we're all, and it's a question-friendly learning environment. So my research, or the study I did, kind of indicated that this tool really did have an impact on students, and that students become more question-friendly, and that's exactly what we want. Okay, so that's okay, so that's covering the first one. So students and preceptors both feel pressured to move along. Anytime I precept at my health center, it's stressful because I have 9 patients in a 4-hour session, and the student goes to see somebody and they're coming back to see me. So I really need to make sure I don't have 20 minutes to discuss the case. I have 3 to 5 minutes. So that's kind of like a practical situation. Let's see. One of the aspects that can change in the use of system, how their learning needs addressed. Yeah, so again, talking about how we can address their learning needs in this 3 to 5 minute period. Okay, so this is the example. I use the case of asthma, but it's similar to the chest pain, where if a student sees a patient on asthma and they might have been a respiratory therapist. They don't need to learn anything more about the asthma, but I don't, as a preceptor, know what they know and don't know and have questions about. So they might ask me questions about why I chose this cream for their rash versus another cream that from the visit a month ago. Now so again, this is making a more student-centered learning environment. So it gives the control over to the student's learning. But we as preceptors don't necessarily have to change our behavior other than we have to answer their questions. Okay, so that's an example of it. I want to also talk about something else. So when I did this work in my health center, I created a training for the students. I kept this training for the preceptors rather simple because I didn't want to, I wanted to keep it a student tool versus a preceptor tool. One of the things that I think I'm coming out in April to do a training. One of the things that we, to make this successful is to train the students to deal with preceptors, because every once in a while a preceptor will say, this is what the students tell me, a preceptor will give the student a hard time and say, well, why are you asking me that, you know, for whatever reason. So we need to train the students to feel confident asking different preceptors questions, you know, and saying, I have a question about this case. So that's one of the things that I've learned, is that any good tool, we have to kind of implement it well. So that's one of the things I'll demonstrate with you later on. Let's see. Okay, we talked about that. All right. So how do we use it? So I've told you that, you know, there's a SNAPPS tool. It's a laminated card. I told you that this card, you know, it helps the student present the patient. I told you that it makes it more student-centered because students can probe and the preceptor, and they can create a self-directed learning. But how do you use it, and what practically happens? So what I practically do is I gave the day they began the rotation, as I gave them a laminated card. I showed them a short 3-minute video, which I'll show you in 2 slides. And then I had them practice it with me. And then the students, I told them to use it with the preceptors. So I did a student training. What I did not do, and intentionally I did not do this, I didn't do a preceptor training. I told the preceptors I was going to have the students use the SNAPPS tool and they might use it with them. But again, I wanted to keep it, to put the onus on the student for this tool to work. The 2 trainings are done separately. We train the students for probably about an hour, and in this particular case, because you are the preceptors, we'll do a preceptor training for about an hour. So yeah, so there's 2 different trainings. We don't train the students and the preceptors at the same time together. Okay. All right, so this is a short SNAPPS video. I think I should make clear though, because I might have confused you back here. So because you're participating in this webinar, we can train you as preceptors, but you'll probably be the main. I don't know how Marie wants to unroll things, but you can easily make this just, you train the students, you can have one preceptor who's responsible for it at the health center. So this is like why use it? So the reason why, so what my literature review showed is that, and what my code book showed is that it improves patient presentations. It creates a student-centered learning environment. We've talked about that. It helps students identify their clinical uncertainties. It helps them dig deeper. It helps them kind of make a more rich learning environment for themselves. It promotes the development of clinical reasoning, and it increases the number of differential diagnoses, which is really important in clinical education. There's one more thing I wanted to say. I don't think I've told you the background so much, but SNAPPS is used in medical schools, and it's used all over the world. It's used in Iran, India, Thailand, Japan, and it's not used a lot in this country, and medical schools I can't comment on, but it's probably used more in medical schools, although they also use a lot of the 1-minute preceptor. I don't know if you're familiar with that tool, but it's a way to, it's a tool that medical schools use to kind of figure out what students know and don't know. But just know that this tool is used frequently in medical education in different parts of the world. Okay. All right, so let's see. So how is it used in behavioral health, oral health, and nurse practitioners and PAs? So Marie had asked me to comment on these things. I did a literature search because I really can only comment on, practically speaking, I can only comment on how it would work into nurse practitioner and physician assistant education. by doing a literature search, I did find that in India, dental training, it was used in dental training. So I'm going to tell you about these studies. There was 40 students. So this is SNAPPS used in oral medicine in India. They had two groups, conventional versus SNAPPS, and they did a post-survey follow-up. And they also did a mini medical examination assessment method, which is pretty amazing. And in essence, students felt that the SNAPPS, using the SNAPPS helps them increase their differential, helps them narrow their differential better, helps them improve their ability to differentiate between similar conditions, and improve their knowledge. And this is the outcome of their SNAPPS, the SNAPPS group. And the SNAPPS is in the darker color, but you can see number of basic clinical attributes covered, number of diagnoses, number of distinct comparisons, number of uncertainties expressed, and number of case-related topics. So in dentistry, based on this literature review, it seemed to help. And again, I'm sorry, I don't know the difference between training in India for dentistry versus this country, so I apologize. I tried to find, so this is kind of an open question, like how is it, I don't know how dentists are trained. If it's somewhat similar where students have to present, I can imagine it being used in that manner. Mental health, I did a literature search. I didn't find how it was used in, if SNAPPS was used in mental health training, but I think if I can talk to whoever's in the audience who's a mental health a clinician, and I'm sure there's ways in which you can figure out if it's a relevant tool that can be used for you. Let's see. So these are my sources. And again, it's just based on this, what do you call it, on this research I did over the years. But in summary, this is a laminated card that says SNAPPS on it. It's like the lowest lying fruit of implementing meaningful change into how we clinically educate students in the outpatient environment. I work in a health center as you do. I understand that it's really busy and really crazy, and I also believe that it's really important to educate students in that environment so they leave with a rich experience and want to work there. So the reason I'm doing this and I'm excited about this is it's a very kind of straightforward thing to implement, and the payoff is huge. It's a lamination card, it's free, the training's probably an hour with the student, an hour with the head preceptor, and you can totally change the learning environment around, and maybe we can even recruit students to want to work in the health centers. So that's why I care about it, and that's why I think it's exciting. And I'm done talking, so please let me know your questions or what I haven't talked about or what I have talked about or anything. And I really, really appreciate you listening. I realize it's Tuesday at 6 p.m. and everyone probably wants to eat dinner, so ask your questions, and I appreciate your time.
Thanks, Marie. So we'll go ahead and open the floor up and see if anyone has any questions. We also have Carrie, our Director of Workforce, in here as well. So if Marie or Carrie has any questions, feel free to go ahead and chime in if you have any comments.
Marie, I want to ask one question. Could the SNAPPS be applied to, so I know you said you're not sure about dentistry or mental health, but can it be applied to since the process is the same kind of with clinical rotations, can it just be applied to maybe preclinical rotations or students that are in, like maybe dental students in D1 or D2, early on behavioral health, mental health students?
So what's D1, D2? Is that like the year?
Yeah, years, like Med 1, Med 2.
Yeah, absolutely. Like we're going to, yes, so my students are in year 1 of their training, and I think in the next 2 months I'm going to start introducing the SNAPPS model. So I'm teaching them patient presentations, and I give them patient interactions with the students. But yes, absolutely. And the earlier you introduce it, the earlier you're developing their ability to develop a good patient presentation, become a lifelong learner, ask good questions, dig deeper. Yes, so you can bring it in year 1, year 2.
Okay, cool.
So I'm not seeing any other questions, so we can still go ahead and give it just a few more minutes and see if anyone else has any questions. And is it okay if we also provide your contact information for the attendees if they have any questions like after the webinar?
Yeah, of course. I'd love to answer questions. Yes, I can talk to them on the phone. I can email them, whatever they want to do.
Okay, great.
This is Carrie Farquhar. I have a quick question, and that is about who developed the SNAPPS model? I see a reference to who developed the SNAPPS model.
So right up here, and if you look at the references, the Wolpaw.
Okay.
I think they're the ones that, and so yeah, they're the ones that developed it. I'm sorry, I should have explained that. They did the most work on it. You can see right there, and that name, it's a Thai name, I think. The Sawa. I'm not going to pronounce it. The one that begins with an S. That's they did a lot of work in Thailand. And what's really interesting is that apparently, this is from the literature. This is not my opinion. In Thai medical education, it's more passive versus active. So this was an excellent tool for really helping students become more active learners. So the tool was created by Wolpaw. I should have said in the beginning, Wolpaw. And I did a huge literature search to find out. They use it with athletic trainers, midwives, many medical fields.
Okay, thank you.
I wanted to add to the webinar, Marie is doing a preview to our OPCWI development training in April 3rd, 2019 in Columbus, Ohio. This is a preview of a 90-minute presentation or training that we will be having for our preceptors and our providers. So we are really excited that Marie took the time out to do a preview of our training coming next year. So thank you again for that, Marie. I wanted to throw that out there.
Yeah, and the training will be really, I'm going to make it really practical and straightforward, but you will leave the event really having a good handle of how to use this in your clinic and how to get students to use it.
Great. But does anybody have any questions out there? Okay, I don't think there are any questions out there. So, Marie, I want to thank you for presenting tonight. I know it's late, so we want to thank you again for doing an evening webinar. And we want to thank our attendees for attending the webinar. And please feel free to contact Marie with her contact information that is included in the webinar. And if you have any questions for Marie Grady or Carrie Farquhar at OACHC, please feel free to contact us as well.
And also, we'll send out the updated presentation. I believe the one that's in there is not the updated version, but there will be an updated version sent out most likely tomorrow.
And again, thank you everybody for listening. I really appreciate your time.
Great.
Great. Thank you. Have a good night.
Thank you.
Bye-bye.